Good day, ma'am. I am Leslie de la Pasion from DSN 22 Group 2. So, this video remains the demonstration of the eye assessment. And before we proceed to the procedure, uh, we have to arrange the materials, the clean gloves, the Snellen chart, the newspaper, the cover of the eye, the object, and the pen light. So before we proceed, there are 3 things to remember. Introduce yourself and explain to the client what you are going to do. So, good day, ma'am. I am Leslie de la Pasion, your nurse for today. So, for today, I will assess your eye. And then next is provide for client's privacy by drawing the curtains or closing the door. And then next is use alcohol for infection control. And then put the gloves. For the procedure, inspect the eyelids and the eyelashes, the position and the appearance, and then the blinking. And then for the normal findings, lid margins, moist and pink, lashes are short and then evenly spaced and curled outward, and then lower margins at the bottom edge of the iris. And then for the blinking symmetrical, involuntary, and at approximately 15 blinks per minute. And then next is inspect the conjunctiva and sclera for clarity and appearance by separating lids with thumb and index finger and asking the client to move up, down, and to the other side. Ma'am, can you please tumingin po kayo sa kabilang side? Sa taas po, sa baba, and then to the other side. And then for the normal findings, bulbar conjunctiva is clear with any tiny vessels, visible peripheral conjunctiva, and then the sclera should be blue-white. And then next is inspect the cornea by using the pen light for lighting for the appearance. And then for the normal findings, it is transparent and smooth and moist. Next is inspect iris and pupil for the following: the shape, equality, and the color. And then for the normal findings, it is round, equal, and uniform color. And then next is inspect for the lens for clarity. And for the normal findings, it is clear. And then next is inspect and palpate the lacrimal apparatus. And then for the normal findings, the puncta and the puncta side of the upper, and the mucosa is pink and no tenderness or discharge noted when the pressure is applied. And then next is check for visual acuity using the Snellen chart. Ma'am, paano po tayo? And assuming that the client is in the 20 feet away. Okay, are you ready, ma'am? So, ito, Pakibas.
P.
And then using the card for close the this one.
P. P. D. O.
And then there. And then next is using the newspaper, ask the client to read the newspaper. Basa. Pabasa po.
Stand in front of the client. Ask the client to flex the head slightly forward.
And then for the normal findings, the client reads print at the 14 inches away from the newspaper. And then next is for the normal findings is 20/20 OD and OS with the hesitation. And then next is check for the peripheral vision. Face the client at a distance of 2 to 3 feet. Clients and examiner look directly ahead and cover eye directly opposite each other. Ma'am, cover niyo po yung isang face niyo. And then say move po, if i-move ko na po yung
Move. 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 Move.
Okay, for the normal findings, the client and the examiner report seeing object at the same time as it approaches peripherally. And then next is check for accommodation. Ask the client to stare at one object with 3 to 4 feet away and move object in a toward client's nose. Ma'am, tingin lang po. And ito po. Tingin po kayo. And then for the normal findings, the pupil converge and constrict as object move in toward the nose. And then the pupil's responses are uniform. And then next is for the number 10, check for the extraocular movement. Ask the client to move, ask the client to follow object as it is moved in 6 cardinal fields. Say move po if pwede ko na po i-move.
Move. 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 Move.
And then for the normal findings, both eyes move in a smooth, coordinated manner in all directions. And then next is check for response to light. Check for the corneal light reflex by asking client to look up, straight ahead, and then shining light toward facial midline. And then we use pen light to do the procedure. And then for the normal findings, reflection of the light noted at the same location on both eyes. And then next is check for the direct pupil responses by asking client to look straight ahead and then approaching each eye from the client's side with a pen light. And then for the normal findings, illuminated pupil constricted. And then next is check for abnormal eye movement using cover or non-cover test. Ask the client to look straight ahead, covering one eye with a cover card, and observe uncovered eye for movement. And then for that, we use the cover card. And then for the normal findings, uncovered eye does not move as opposite eye is covered. And then covered eye does not move as cover is removed. And that's all for the demonstration of the eye assessment. Thank you for watching. Good afternoon, ma'am. I am Lacian de la Pasion, from BSN 22 Group 2. So, this video remains the demonstration of the nose assessment. Before we have to proceed to the procedure, we have three things to remember. Introduce yourself and explain to the client what you're going to do. Good afternoon, sir. I am Leslie Andela Pasion, your nurse for today. So for today, I will assess your nose. And then next is provide for client's privacy by drawing the curtains or closing the door. And number three is hand washing or use alcohol. And then next is assemble the equipment or the materials, the clean gloves and the pen light. So for the first procedure, we have to observe the external nose for the following: the skin appearance, the shape, and the nares. And for the normal findings, for the color is same with the face. And then the consistency is smooth. And then the symmetrical appearance is no changes with the nares and with respiratory. And then for the second procedure, inspect the inner nose for the following: the appearance and the landmark of turbinates and septum. And then for the normal findings, mucosa is pink and moist uniform color and no lesions. And then for the turbinates is multiple middle visible and no lesions, no visible lesions. So sir, I will inspect your inner nose. And then for the next procedure is we have to assess the function of the nose for patency. The client's nose should be closed and the one nares is occluded, and feel free for the air. And then for the normal findings is air is felt being exhaled through the opposite nares, and it should be noiseless. Sir, pakigaya na lang po ako. Ganun po, pakitakpan po yung isang butas ng ilong, and then close po yung mouth, and then wala po dapat. Exhale. And then for the next procedure is palpate the external nose for firmness. And then for the normal findings is solid placement, no nodules. So that is the procedure for the nose assessment. Thank you. Good day, ma'am. I am Leslie de la Pasion from BSN 22 Group 2. So this video remains the demonstration of the ear assessment. And before we proceed to the procedures, we have three things to remember. Introduce yourself and explain to the client what you're going to do. And next is provide for client's privacy by drawing the curtains or closing the door. And next is hand washing or using alcohol for infection control. And the materials are clean gloves, the pen light or otoscope, the watch with hands, and then the tuning fork and the ruler. So we proceed to the procedure. First is we have to inspect the external ear, the size, the shape and position. Before that, use the gloves for use the ruler to align the pinna and the side of the eye. And for the normal findings, it is equal size and similar appearance. And number 2 is palpate internal ear or external ear. And then for normal findings is non-tender auracle. And number 3, palpate mastoid, the tenderness, temperature, edema, and using the otoscope. And for the normal findings, it is no tenderness or pain and no warmth. And next is we inspect the auditory canal using the otoscope. We inspect the ceramen, appearance, and the tenderness. And then for the normal findings, it is color black, dark red, gray, and brown. And for the odor is none or odorless. And then the canal is canal wall is pink. And then for the procedure number 5, we assist we inspect the tympanic membrane, the color, consistency, and the landmark. And for the normal findings, it is pearl gray or shiny, and it shows movement. And then for number 6 is auditory function, using by whispering words. Ma'am, tayo po tayo and pakiulit na lang po yung sasabihin kong
Thank you.
Okay po ma'am, upo na po tayo dito. And next is hear the watch TikTok. So ma'am, tayo po tayo ulit and pakinggan po na. Can you hear it, ma'am? Okay po. And next is for using the tuning fork. Do you hear vibration, ma'am? And yan po. Yan. And next is for last procedure is perform the Romberg test for equilibrium. Clients stand with feet together. With feet together, and client will stand straight with minimal swaying. Tapos ganun po yung kamay. Pikit po, ma'am. So as we can see, the client has the minimal swaying. Okay po, upo na. And that's all for the assessing the ear. Thank you.